Welcome to the Holistic Christian Life channel. I'm Richard Strait, the teacher, and in this series, ongoing series, we try to alert the Christian and non-Christian alike that we aren't only to be concerned about our soul, that's primary, because we're going to live on for eternity. But we also need to be concerned about our physical, mental, emotional, spiritual, of course, and social life. Today, we want to study the holistic Christian life presents the autumn common illnesses. In a sense, this is a long lesson, and I'm going to skim over some slides, but you can come back to these slides over and over and get them into your mind and into your relationships. We have lots of information, these pieces of information about the cold, flu, and COVID, some news broadcasts, some commercials, some reading material. But we need to stop and really think about this whole process. It's important that a person, especially Christians, get serious about our health. The following lesson will emphasize a person's awareness to his or her body on a day-to-day basis. Also, one's home environment, work environment, church environment, and other places that you may frequent. In the mental aspect of life, we need to know the facts about the disease, especially this time of the year, the common cold, allergies, flu, and COVID. This also includes knowing prevention, knowing an illness's symptoms and treatments. Emotionally, there is no need for panic, but for stable self and family. We need to pray daily about our life and its challenges. However, in the time of sickness, it's very important to put our faith in God and His strength. Socially is a big part of life. However, there needs to be precautions about being around people when we are sick or they are sick. Beware of coughing, including covering the mouth and nose. This is especially true of home environment where we are more relaxed and less mindful of our actions. Touching is a part of most people's life. However, be aware of close contact with others, even in the family, when we are sick. Ephesians 40:30 through 31, Moses placed a wash basin between the tabernacle and the burnt offering altar. The priests washed their hands and feet before entering the holy place. This indicates that hand washing is important. Yes, they was washing it because they had just slaughtered animals for the sacrifice and washing the blood off, but it's also important to recognize that as they were going into the holy place, they wanted to be clean. And we think, well, as I go to church, I did take a shower, bath. Well, yes, and that's okay. But we also need to understand that our home is a place where we need to be careful in our washing. The common cold. Most often the symptom starts in 1 to 2 days after someone is exposed to the cold virus. Symptoms vary. They can include runny or stuffy nose, sore, scratchy throat, cough, sneezing, generally feeling unwell, slight body aches or a mild headache, and even low-grade fever. The mucus from your nose may start out clear and become thicker and yellow or green. This change is normal. Most often it doesn't mean that you have a bronchial illness. When to see a doctor? Well, for the cold, generally speaking, it will go away in about 7 days. But if its symptoms that we just gone over linger, or if our fever goes up over 101.3 Fahrenheit, and they last more than 3 days, shortness of breath, wheezing and intense sore throat, headache or sinus pain, maybe it's good to call the doctor. When to see a doctor for a child? Again, for the common cold, children don't really need to follow a doctor. With a fever of 100.4 Fahrenheit, yes. Up to newborns up to 12 weeks may need that. Raising fever or fever lasting more than 2 days in a child of any age. More intense symptoms, I should say, like a headache, throat pain, or coughing. Trouble with breathing or wheezing, earache, and mostly children will get fussy or have drowsiness as some typical symptoms, and no interest in eating. And if this starts out and continues, then you need to get to a doctor. Many viruses are cause of a common cold. The cold virus enters the body through the mouth, eyes, or nose. It can spread by droplets in the air when someone is sick and coughs and sneezes or talks, especially talks in your face. Hand-to-hand contact with somebody who has a cold. We don't know if the hands have been washed or how long ago, or they're carrying cold germs. Shared objects with a virus on them is a no. That's dishes, towels, toys without being washed, and use some infections on them. Telephones today are basically cell phones, but you need to be careful of using someone's cell phone who is sick. Touching your eyes, nose, or mouth after contact with the virus is surely ready to spread it in you. Factors of getting a cold, we're not going through all these, but infants and young children are at risk. Older people are at risk. Weakened immune system. The time of the year, like the fall and winter months, smoking, exposure to being in crowds like school, airplanes, or as the holiday seasons approach, being in crowded malls and stuff. This isn't as common today because of a lot of online ordering, but it still is there. And also, movie theaters and all those places. Mild earaches, the swelling and buildup of fluid in the space behind the eardrum. Child or even an adult that's having inner ear ache infections need to see a doctor. If a person already has asthma, the doctor has told them how to control that, but a cold may make it worse. And again, as it would get worse, it needs to have medical attention. Sinus problems seem to be the rage today, partially because of allergies that's in the air combined with viruses, and this can go down the throat and into the bronchial tubes, into the lungs, and people with a weakened immune system has a risk in these conditions. Some of the prevention, you've already heard of it many times, probably washing your hands. If you use sanitizers, they should be at least 60% alcohol. Too many of the sanitizers have perfumes and stuff in them that actually prohibit the killing the germs and even cause the worse. So be careful of that. 60% alcohol is a good measure. Clean and disinfect areas where you live, doorknobs, light switches, electronics. Be careful of those. Don't get them wet. Kitchen and bathroom countertops especially needs clear. Cover your mouth when you cough and sneeze. If you can put your mouth, nose into your elbow, but still wash your hands afterwards, and use Kleenex instead of handkerchiefs, and throw that Kleenex away immediately. The handkerchief has the germs and carries it for a while. Don't share drinking glasses of silverware until they have been washed. Stay away from people with colds if you can. During the COVID, we was told to stay 6 feet. That would be good. Review if you possibly can. If you're a caretaker of a small child, it's not possible. Review your child care center if you have children in the care centers, and take care of yourself. Eat well, exercise, get plenty of sleep, and stay healthy. In Leviticus 14:8-9, the Israelites was instructed to wash their clothes with water, bathe with water, to remain isolated when having a communicable disease. These were guidelines for their daily living. Now, a lot of those was connected with husband and wife's intimacy, but it was a policy that went throughout the Israelites to clean and be clean around them, not only their clothes, but make sure there was no trash around the tents in the community. The flu, sometimes called influenza, is an infection of the nose, throat, and lungs, which is a part of the respiratory system. It's caused by a virus. The influenza virus is somewhat different from the stomach virus, but oftentimes when we have the influenza virus, it seems like it affects our respiratory system and our stomach. Many people get better with the flu on their own by drinking lots of fluids, by resting. But if you have complications, you need to take care of those and call the doctor. Annual flu shots helps lower the chances. It's not totally a guarantee that you won't get it, but oftentimes it makes it easy, lighter. They prevent by cleaning and disinfecting surfaces, washing hands, keep air around you moving at the time of the year. Symptoms of the flu is sore throat, runny nose, or stuffy nose. There might be others. That's what kind of we can't tell sometimes if it's a cold or the flu. But the flu includes fever where colds usually don't, coughing, headaches, muscle aches, feeling tired, sweating, and chills. Be careful if you have a weak immune system or you're sick for other reasons. Just ward down because it will cause more problems. Now, if you had trouble breathing or shortness of breath, chest pain or pressure, undergoing dizziness, hard to wake up or confused, dehydrated, seizures, worsening of the existing medical condition, severe weakness or muscle pain, get to the doctor or the convenient urgent care or emergency room to get medical help. In children, they may be fast breathing. As you watch them, the lips may pull in with every breath. Gray or blue lips and nails. They don't cry. They have a dry mouth, along with not needing to urinate. Frequencies such as fever, cough, and things continue to get worse. Get to the doctor, convenient or urgent care, or the ER. And remember that younger children, younger ages, especially those 2 and younger, have a tendency to get these fall, winter colds and flu quicker than a 6-year-old might. And adults over 65 not only have a weak immune system, but they catch these frequently. Chronic diseases may increase the risk of influenza. If you had these, talking to your doctor about them even before the flu season comes along. Many times we find that race has hospital needs for influenza, and some of this is simply because of the poverty in which they live, and fighting immune systems all the time. We need to be careful of aspirin therapy because Ryan syndrome can infect children and teenagers. Ladies that are pregnant need to be very careful about taking medication and the severity of this disease. Obesity. People overweight, so the immune system's often low, and susceptibility. There's other complications like acute respiratory distress syndrome, muscle damage or swelling, toxic shock syndrome, worsening of the chronic illness such as asthma or kidney disease. Prevention. The flu vaccine is probably the front runner of all. Again, ladies that are pregnant need to consult their doctor about those shots and how to deal with them. There is a risk of serious illness for all people, especially young children and older adults, even the risk of dying. So talk with your primary care doctor, have an honest talk with that provider, and get some help even before you need it. Some more prevention things. Not only are there shots, but there's a nasal spray between ages of 2 and 49. It can be recommended, has been recommended by doctors, so check with them. Severe allergy reaction, pregnancy, young people who take aspirin or the silicone containing medicine, people with weakened immune system, and people who are caregivers in close contact with those should again consult their doctors before the flu season gets a good hold. More about children with asthma. People who recently took antiviral medicine for the flu need to be sure that they tell their doctor about that. Check with your healthcare care team all the time. We are using these materials from Mayo Clinic. Again, hand washing is probably next to the vaccine. Not touching your face and nose and eyes, rubbing your eyes or your nose, mouth. Cover the coughs and sneeze. Be sure you can clean surfaces. Avoid crowds when the flu is going around the most. Staying home is much safer. Deuteronomy 23, 12 through 14 tells us about keeping our living area clean. Some people may be offended, but it's the scripture that goes before health inspections. You shall also have a place outside the camp, and go out there, and you shall have a spade among your tools, and it shall be when you sit down outside, you shall dig a hole with it, and shall turn to cover up your secretment. Since the Lord your God walks in the midst of your camp to deliver you and to defeat your enemies before you. Therefore, your camp must be holy, and he must not see anything indecent among you, or he will turn away from you. So it's important to, in our day, to use restrooms when necessary, and to make sure that no messes, including animal secretions, are on our property that might carry diseases. COVID-19, man, I'm telling you, and you look at this Mayo Clinic staff thing, and you and I oftentimes can't make the difference. But it's a dangerous disease. It attacks maybe with the weak immune system from a cold, seasonal allergies, the flu, called emphysema, and many other similar symptoms. Understand the difference between cold, flu, allergies, and cobra is very important. And to keep it from spreading is extremely important. It's a respiratory system, mainly. Once in a while, some other parts of the body is affected by it. But again, it's a particular virus, SARS-CoV-2. And it is spread in the same way that colds and flus are. Coughing, sneezing, living without disinfectant. It needs our full attention. Notice these symptoms. COVID-19 and cold. And we see that it is often tough to know the difference. And so that's why specific COVID-19 tests can be given to find its problem. Here's some more symptoms. And see, they are often very regular. It usually starts 2 to 14 days after exposure. Symptoms of cold usually occur in 1 to 3 days. There's no cure for the common cold. You may take some so-called over-the-counter medications to relieve some symptoms and make you feel somewhat human. COVID-19 is not caused by a virus. Seasonal allergies are immune system response triggered by exposure to allergens such as the pollens. We may have some of the same symptoms of seasonal allergies. Here's a couple of the differences between COVID and allergies. COVID and the flu. Again, it might make it almost impossible for us to know the difference. That's why we need to get the tests. COVID, the flu continues. You can transmit COVID even before you know you had the symptoms. So if you think you've been around it, voluntarily distance yourself, drink plenty of liquids, get rest, and if the symptoms continue to develop, get tested. Here's a list of some of the vaccines that you can get for the COVID. Prevention is always better than trying to cure something. So in the cold, flu, COVID season, we need to get our vaccinations before that. Avoid being around somebody that's sick or has the symptoms. Distance ourselves inside public spaces. Wear face masks inside public spaces. Wash your hands is number one here again with soap and water for at least 20 seconds. Or use alcohol, that's 60% base, hand sanitizers. Avoid crowded spaces. Improve indoor airflow, including opening windows and turning the fans on to get some of the junk out. Cover your mouth and nose. Avoid touching your eyes, nose, and mouth. Avoid sharing dishes, glasses, towels, bedding, or other items if you're sick. Regularly clean and disinfect high-touch surfaces. Stay home from work and school and other public areas in isolation, even in your home with your family, while you're at the height of your COVID disease. It's interesting as we close, we may hear the phrase often, cleanliness is next to godliness. However, it's not in the scriptures. And we believe as we look at history that John Wesley, co-founder of the Methodism or the Methodist Church, may have been the inventor of the phrase, cleanliness is next to godliness. He emphasized cleanliness in his preaching, but the principle behind the rule dates back long before the days of Wesley to the worship rituals laid down in the book of Leviticus. Take care. Watch the video again and again. Get all the symptoms down. Take care of yourself.